Health Pediatric Neurologist Dr. Guillermo Philipps says tics are common in kids.
About 1 in every 5 kids may have tics during childhood age. And then a subset of those children are going to have chronic tics, and probably about 0.5% of kids end up having Tourette syndrome.
Tourette's is defined by having multiple motor or vocal tics occurring frequently before the age of 18 and lasting longer than a year.
It could be blinking, it could be rolling your eyes, it can be making facial grimaces, head movements, neck movements, other body movements, hand movements. They can be simple or complex.
If you see that your child has tics, take note of what they're doing.
Does it seem to bother the child? And does it seem like there's anything that might be triggering or affecting them? And touch base with your pediatrician.
People with Tourette's often have coexisting disorders.
These include attention deficit hyperactivity disorder, obsessive compulsive disorder, mood disorders. Assessing for those and controlling for those and addressing those can often help the tics.
The tics can be triggered by stress. The severity can be thought of on a spectrum from mild to severe. While there's no cure, habit reversal training is possible.
And that's where a therapist teaches the child to recognize the tics and then to produce a movement that would essentially replace the tic.
Tics usually peak from age 7 to 12 and decline as the child ages. However, some will have tics into adulthood. For Lee Health, I'm Devin Turk.